everybody. We are live tonight with Dr. David Hanscom. He's no stranger to Brain Chat. He's been on quite a few times, and he is just a wealth of knowledge. And Dr. Hanscom, thanks so much for your time again for coming back on Brain Chat.
Yeah, thanks, Ryan. I always enjoy talking to you often on the air. So yeah, this is great.
Thanks so much. And for people that don't know Dr. Hanscom is a retired spinal surgeon, and he's the author of 2 books, Back in Control, and most recently, Do You Really Need Spine Surgery? So Dr. Hanscom offers a really, really interesting perspective on using neuroplasticity-based practices to help you out of chronic pain. And he'll tell you himself that he basically kind of put himself out of spine surgery business by figuring out ways to make the brain change to help reduce chronic pain symptoms. But Dr. Hanscom also has some amazing information on anxiety and stress. So I'm going to kind of let him take over, but I'd love for you, Dr. Hanscom, if you can kind of just tell everybody what you've been up to most recently while we've been hunkered down during the Corona times.
Well, Ryan, thank you. I quit my spine surgery practice for a couple of reasons, but the main one being is that we're watching hundreds and hundreds of patients go to pain-free with a self-directed process. It wasn't a big pain clinic. It was concepts. It was retraining the brain. People pretty much did it on their own, and it was consistent. What was happening, I've seen conservatively well over 1,500 patients go to pain-free. At the same time, I was watching 3 to 5 patients every week undergo spine surgery that they didn't need. And what would happen after they failed spine surgery, Ryan, as you well know, why people don't do well. They end up, with a bad back. I call it the surgical scrap heap where nobody will take care of. The surgeon won't, primary care won't, they're overwhelmed. Everybody's well-intentioned, but nobody has time, especially if you've had spine surgery. So I ran across a situation where a 30-year-old gentleman did not need surgery, had a pretty complicated operation, way more complicated than needed to be done, and he was paralyzed. I remember the moment walking back to the computer and looking at this guy and going, I'm done. I'm just not going to watch this anymore. But it's been getting worse the last 10 years. And now instead of doing 1 and 2 level fusions that don't work, we're doing 8, 10, 12, 14 level fusions that don't work. And the complication rate is horrendous. There's a 73% chance you'll be readmitted to the hospital within 2 years after one of these major spine operations. So what I've been up to is that, even though I quote retired, I stopped practice in January 2019. As you probably figured out, knowing me as well as you do, that I'm still working probably 8, 10, 12 hours a day on this project. But I'm excited about it because I continue to get emails every week of people that are going to pain-free. What I'm up to is that I just put together a process called the Doc Journey, and it can be accessed at www.thedocjourney.com, and that's spelled DOC, thedocjourney.com. And I've sent Ryan and his society the links to that. I also have a website, drdavidhanscom.com, and I'm changing the whole format to, first of all, people got better with the book and the website. That was it. But the website, as you know, is loaded with a lot of posts. It's a little unwieldy. So this new process called the Doc Journey is loaded with a lot of stuff. So first of all, the app isn't quite done, but that'll be out in November. And that'll be a backbone of the whole journey. So you don't have to decide what to do next. It'll be right there. Then there'll be sidebars of 4 to 6 minute videos explaining in detail each step of the way. And as you know, expressive writing is that one factor that really starts the process. But connected to expressive writing will be 7 little 4 to 6 minute videos explaining the different aspects of expressive writing. And what I'm doing, I'm basically taking a combination of the website and my book and creating sort of a 3-dimensional process. So the app will be the backbone of it. Then these teaching videos will be unique, also part of it. Once a month on Wednesdays, there'll be an additional webinar to discuss a given topic in detail. And then on Tuesdays and Thursdays that I'm doing now, but also be part of the Doc Journey, is that I hold an open roundtable. And right now my website is called backincontrol.com. But you'll be able to access the question and answer period. So from noon Pacific time, every Tuesdays and Thursdays, I spend an hour with a group of people Today, there was 35 people on the line. And in the last 4 months, we've had 6 or 8 people that are pain-free just in the context of that group. So that's been really one of the most enjoyable parts of the process. So that's the stuff we have going just with the DOC project. And again, DOC stands for Direct Your Own Care. You wanted to, so anyway, let's stop there just for a second, because I want to talk about the Wednesday group in a second, but just let you give, that's just an overview of what I want to do. Then I'll convey the main message of what I'm trying to get out there in a second.
With the Direct Your Own Care, like this is something that you've had, like you mentioned, for several years on your website, but you've been in the background working on the app with your team to make it more accessible and just a little bit more easy to follow.
Right.
And this is for, so who could benefit from using your app and using the technique that you mentioned in your book and on your website, using Direct Your Own Care?
Well, that brings up the main message that I really want to bring out to the world, and that's why I quit my practice. So first of all, there's mental pain and physical pain, and it turns out the mental pain is the biggest problem. And I worked with the Dr. Stephen Porges, who wrote a book called The Polyvagal Theory in 2011, but he's been studying the interaction between the nervous system and the environment for over 40 years. It's called the autonomic nervous system. There's a sympathetic nervous system, which allows you to do a fight, flight mode and defend yourself. But when you're in this fight, flight mode, your heart races. If you're threatened, your heart races, your muscles tense up, you sweat a little bit. And I always thought about the fight or flight response in terms of adrenaline and cortisol and histamine. Turns out that the biggest aspect by far is called cytokines. Cytokines are the little small proteins that are the communicators between cells. There are trillions and trillions of them in the body. They're on every cell surface. And they tell so there's inflammatory cytokines that flip on the inflammatory switch, which are white blood cells. And then there's anti-inflammatory cells, which promote healing and regeneration. But when you're under threat, the cytokines fire up. So I didn't understand the role of the immune system in chronic pain. So first of all, anybody can use it because everybody has anxiety. So the sensation generated by a threat is anxiety. Now, Dr. Porges hates the word anxiety, and I'm now learning to do the same, is that anxiety is just a sensation generated by this threat response. Now, the key is, what is threat? So there's viruses, bacteria, bullies, predators, unpleasant bosses, etc. That's a threat. Poverty, lack of opportunity, fear of police authority, those are all threats. Those are real threats. Those are physical threats. But mental threats are unpleasant thoughts, obsessive thought patterns, repressed emotions are a big deal. And what happens is that humans have a problem called consciousness. I call this the curse of consciousness, is that humans cannot escape their thoughts. Every human being is subjected to ongoing threat in the terms of thoughts. So you can suppress them, experience them, or mask them. None of those works. Humans cannot escape their thoughts. The problem is we treat stress as a psychological construct. Is that a fair statement? That we think stress is a psychological thing?
Yes.
Okay. So stress is the response to a threat. Remember, there's distress and eustress. So we have this total body response to a threat. So what happens, stress is that total bodily response. And the key here is that this total bodily response processes about 20 million bits of information per second, 20 million. You know, when you chew your food, you don't think about your jaw muscles. As I'm speaking, my tongue is doing things automatically. My pupils are dilating or constricting depending on whether I look at this light or looking at you. So all that's automatic. It's incredible what the body does. So that's all unconscious. That's 20 million bits of information per second. Guess how much the conscious brain processes? Just to take a guess.
13.
You already sort of knew the answer. It's 40.
Oh, really?
40,
Okay.
yeah.
Okay.
I mean, you're closer than most people, but people think, well, maybe a million or 2 million or 1,000. No, it's 40.
It's my default guess number, so I was.
Yeah. So it's 20 million versus 40, and you're not going to control anxiety with your mind. You can't do it, right? 20 million versus 40. So if you remember my story from a couple podcasts ago, is that I was a fearless spine surgeon. I went to one of the top spine fellowships in the world. The spine surgery that I performed was extremely complex. And as you know, if you do something over and over and over again, it becomes normal. So I was in this world of doing really complex spine surgery, but it's just what I did. But I was fearless. That's how I get there. I was fearless. My attitude was bring it on. In one day, in 1990, I went from being a fearless surgeon to a panic attack in one day, actually 5 minutes. Once that panic attack occurred, I could not stop it. There was panic attack after panic attack, crippling anxiety. And I never could figure out how could I go from a fearless spine surgeon to crippling anxiety in one day. And I went to psychology and counseling for 13 solid years. I went to psychotherapy for 13 solid years, once or twice a week. That's a lot of psychotherapy. And guess what happened? Remember, I didn't know about the unconscious versus conscious. I knew nothing about chronic pain. And remember, when you're under constant threat in the form of unpleasant thoughts, your body chemistry is off. Remember that anxiety is just that sensation generated by a threat. The threat what got me in deep trouble was I suppressed emotions. I didn't know what anxiety was. I had to look it up in a dictionary one day when a patient came into my ward with an anxiety disorder. I had to go to the dictionary and look up the word anxiety. What's this word? What does this mean? So I was so good at suppressing anxiety, I had no idea what was going on. So repressed emotions turned out to be a threat. My body chemistry was way off. At the same time that I wasn't feeling anxiety, I had burning on my feet, skin rashes popping up all over my body, my scalp itch, migraine headaches, back pain, neck pain. I had 17 different symptoms. Because remember, when your body's physiology is off, it has an effect on every cell in your body. What happens is that there's a term now, you may have heard this already, the medical profession has figured out, called medically unexplained symptoms. That if a doctor can't find something wrong on a test, it can't be explained. They just put this diagnosis category out called medically unexplained symptoms. Okay. So what's your impression when I say that?
Sorry, no idea.
Well, I mean, it applies to the patient that's in their head. That they must be imagining this, right?
Exactly, yeah. It's all in the head.
Well, but I think it's also the final insult, because if you do MRI scans to these people, I mean, so what's happened, bottom line, I'll jump to the end of the story without ranting too much. The data has been in there in thousands of research papers about what the problem is. And so I had gone on this 30-year quest to find out how can I go from a fearless surgeon to crippling anxiety. Now, I wasn't against it being psychological. I just wanted an answer. But again, it's 20 million to 40. You cannot solve the psychology, and it's not psychological. It's just your body's response to a threat. So I'm going to ask you a rhetorical question that you won't answer. Okay, but it's just for teaching. I'm not trying to put you on the spot. And I know you can take it anyway, right?
Bring it on.
Okay. That was my attitude, by the way, that got me in trouble, is bring it on. But no comparisons here. Anyway, okay, so anxiety is just a sensation generated by that total body response. Your inflammatory cytokines are elevated. You don't feel good. And by the way, they found out that anxiety, depression, bipolar, OCD, obsessive compulsive disorder, and schizophrenia are all inflammatory disorders. So what happened for me as I started working with Dr. Porges is that the autonomic nervous system fires up in response to threat in addition to everything else. What the autonomic nervous system does, it fires up the immune system, which fires up the cytokines. All those, quote, psychological diagnoses are actually inflammatory responses to a threat. It is not psychological, it is physiological. That's why this term medically unexplained symptoms is so upsetting to me, because everything's wrong. And in fact, less than 5% of the time do we find, quote, a structural problem. But when your body's when your entire body is inflamed, including the glial cells in your brain, which sensitizes everything, things are really wrong. And the symptoms are completely explained by the changes in the body's inflammatory process. Turns out that also cardiovascular disease, peripheral vascular disease, adult onset diabetes, Parkinson's, Alzheimer's are all inflammatory disorders. So as I started with Dr. Porges, why I had completely forgotten about cytokines, which I barely learned in medical school. Most physicians have forgotten about these. So there's a friend of mine, Dr. David Clausen in Seattle, and Dr. Portis got into the same room. And every Wednesday night, and you're welcome to post this on your site, by the way, but we have a think tank. And Dr. Portis and Dr. Clausen are sort of the stars. And I will give these two people full credit for changing my paradigm about inflammation, stress, threat. So the essence of the problem with chronic pain, by the way, the reason why chronic pain is inflammatory disorder, which is also included, is that these cytokines attack the myelin, which is the lining around the nerves that improves conduction. So it damages the nerves themselves. And for instance, we think diabetic peripheral neuropathy has more to do with the inflammatory response than it does these sugars. So what happens, you've doubled nerve conduction. So as you calm down the nervous system, you actually improve the nerve conduction, the pain really does disappear. Okay, so I'm going to sort of stop there as far as the concepts I want to cover, because I want to go back and make sure we deepen this a little bit. I'm going to go back to the question a bit again. Okay, does it make sense to you, or I explain it clearly enough, that anxiety is just a sensation generated by a threat?
Yes.
Okay, and that mental threats are a bigger problem because you can't escape your consciousness?
Yes.
And we know every human being has to deal with this, everyone. So the question is, it's 20 million to 40 ratio of power. In other words, you're processing a lot of information unconsciously. How do you decrease anxiety? If you can't do it psychologically or mentally, how do you deal with anxiety?
Your work.
You should be in politics.
Well, I mean, it's difficult because if you try to consciously shut down the subconscious, it can become a very difficult task, which is maybe why it, like you mentioned, 13 years of psychotherapy didn't really work for you. So addressing the inflammatory response.
There you go. Okay, so I'll use a more simple term, but that is correct. Okay, anxiety represents a sensation generated by elevated inflammatory markers, elevated stress chemicals, and what you do is simply lower the inflammatory markers. That's it. The essence of chronic pain is ongoing exposure to threat in an inflamed, I'll use the word inflamed nervous system, but your whole body's inflamed. Everything's inflamed. These cytokines are on every cell and every organ in your body. So what you're dealing with, the essence of healing is promoting safety. So what happens, you can't control your thoughts, for instance, but you can use tools to separate. So the essence is you calm down the inflammatory response. You can do that directly or through neuroplasticity. And the category of direct ones are things like mindfulness, meditation. Just drop your shoulders for a second, take a little bit of a breath, and that's a direct way of just simply dropping down your inflammatory response. So again, to decrease anxiety simply decreases inflammatory response. What I've also learned since I talked to you last, which I'm excited about, is that slow breathing. Just breathing less than 10 breaths per minute, not anything special about it, and being relaxed drops down your inflammatory cytokines. Mindfulness meditation drops down inflammation. When you breathe through your nose, is that it increases your levels of oxytocin, which is the love drug, by 1,500%, just breathing through your nose, because you're stimulating the vagus nerve in the back part of your nose. When you hum, singing actually stimulates the vagus nerve in the back part of the throat. There are certain tones of music like lullabies that actually calm down. But what you're doing, you're directly stimulating the parasympathetic nervous system, which counteracts the sympathetic response. So Dr. Portis likes to use the word anxiety instead of the word anxiety is elevated sympathetic response.
I like it.
Okay, so there's three parts to it. So there's the first thing you have to understand is to separate from anxiety. You gotta separate from it. It's what you have, is not who you are. If you didn't have anxiety, you would survive more than a couple of minutes because it's what keeps us alive. So it's a gift, but it's what you have, it's not who you are. So you gotta understand that, separate anxiety, visualize a large thermometer, and when you're upset, just visualize this thing going up the wall, and you wanna drop it down, just drop it back down. So the first step is to separate from anxiety as what you have but not who you are. Then the direct ways of doing it include mindfulness, meditation, relaxation. Well, what I'm excited about when you use these tools that we call, quote, relaxing, You're directly stimulating the vagus nerve as an anti-inflammatory response. So the breathing exercises, humming, listening, dropping your shoulders, meditation, all are directly dropping down inflammatory cytokines. That's not psychological. You now have control on your body's physiology. Of course, one of the antidotes to anxiety is control. And so you now have the tools to control your anxiety. You can't control your thoughts, but you can start chilling out your body's response. The other one is neuroplasticity, where you stimulate your brain to rewire. And the sequence is awareness, separation, reprogramming. You and I have talked about expressive writing a few times. But we find out that you cannot escape your thoughts, but you can separate from them. So when you write, you have an awareness and separation. And then the third part of reprogram is redirecting. Or just drop your shoulders, relax a little bit. So with expressive writing, you now create awareness and separation in one move. And then redirecting is a little bit of taste your food, feel your shoulders, take a deep breath. And so what you're doing is redirecting. So with neuroplasticity, it's basically stimulus, response. You're creating a space between the stress and the response. And in that space, you're then substituting a different reaction. You're training your brain with repetition to create new circuits, and that's it. So we can go on a really long time about this, and I'm happy to come back and people can ask questions. But if you really want to learn this process in detail, again, it's called the Doc Journey. You can access it at thedocjourney.com. And the sequence is awareness, hope, forgiveness, and play, which is based on our workshops. You have to create awareness of the problem, the nature of the solution. That's the starting point. You can't solve something unless you understand it first. In other words, you have to understand the nature of the problem before you can solve it. So learning about pain and these principles makes a big difference. And again, we just touched the surface. Hope is a big one. And I just want to tell you one story that I just blows my mind. I used to think that there are certain things that you could not solve with these tools. The brain is unbelievably neuroplastic. And you can program your brain around anything. And we have several patients with severe phantom limb pain. I just got an email yesterday from this guy with no phantom limb pain now. How do you do that? I mean, you already have no limb. You can't treat it anymore. You can't do more surgery. But the gentleman I talked to yesterday for a long time, somebody who'd been in chronic pain for 20 years, he's a very competent athletic sportsman, real estate broker, wealthy. He developed chronic pain about 20 years ago or 25 years ago, and it was his whole body. He was depressed, anxious, high dose narcotics, alcohol issues, suicide attempt. He underwent 27 surgeries in 20 years, 27.
Wow.
That's a record for me. And I used to think after 4 or 5 surgeries, 20 years of chronic pain, that those situations weren't solvable. Now he's extreme, but I now see this consistently that you can program, he's pain-free. He's been pain-free now for about 4 years. He says he has never felt better since he was 30 years old.
Wow.
So to me, just with the surgical trauma, how can you get back to your state? And again, the studies on the brain's neuroplasticity, and by the way, neuroplasticity is defined your brain's capacity to change. So even on this podcast right now, as you learn new concepts, your brains form new neurons, new connections, new myelin, all sorts of things change every second. Your brain's incredibly neuroplastic. It can also shift from pain circuits over to relaxation play circuits. So as you learn the tools, in other words, you don't have a choice about the pain. You don't have a choice about experiencing anxiety, but you do have a choice to learn the tools that actually create the shifts. And then again, there's many layers about anger and forgiveness, family issues, life outlook. A lot of things come into the picture. But as you know, the sequence isn't hard. None of this is difficult. It's not work. It's actually letting go. So going back to the resources I have right now, I do have the website backincontrol.com, but actually it's now drddavidhanscom.com. We have the Doc Journey that's coming online. But I would encourage you to jump on the the question and answer periods on Tuesdays and Thursdays, this question and answer period. But we also know that the group interaction is very powerful. And this week on Wednesday, for instance, we're talking about Sue Porges, who is Dr. Porges' wife, is a world expert in oxytocin. And then Les Aria is a phenomenal psychologist from Kaiser. And then Jerry Patterson from North Carolina is phenomenal in the chronic pain world. And she's taken the Doc Project and created group therapy out of the Doc Project and just having stunning results. So they're going to talk about group therapy, but a group therapy, no, I don't want to use the word therapy. You're in a group setting where you promote interaction. And as people share pleasant experiences in a safe environment, people heal each other. And so it may be around oxytocin. So every Wednesday night at 5 o'clock Pacific time, you hit the same link that you hit for the Q&As and just hop onto the meeting. And then next week, Dr. Matt Letterman, who wrote the book Forks Over Knives, is now started a project called Connectin, Kinectin. And again, the essence of healing is connecting to your own capacity to heal, which means you have to connect to you, but you connect to yourself by learning how to connect to other people. If you're angry and anxious, first of all, those are inflammatory symptoms, but you're certainly not connected. So anyway, Matt Letterman will be talking the week after that. We have a whole sequence of think tank type ideas coming out of the Wednesday meetings every week, 5 o'clock Pacific time. And we just had the best time with this thing.
And so are you saying anyone can jump on this to listen in?
Yeah, absolutely. I mean, a lot of it you will understand because I don't understand a lot of it. But this guy is Stephen Porges and his wife, Sue Carter, and then Dr. Clausen they're geniuses. They are geniuses. And I'll say that my contribution is I'm sort of the scribe. I'm trying to coordinate the orchestra. I mean, the conductor doesn't play for his trumpet, right, or for his violin. He conducts it. So I'm conducting this thing, and I'm doing the best I can do. So I'm just blown away. I've learned more in 6 months than I have learned in 30 years. It's just incredible. I can't even put it into words. And we could talk about this for a long time, maybe on another podcast about the whole polyvagal theory approach to chronic disease. But it's all the same stuff, chronic threat.
That would be awesome because we've had Dr. Porges on here a little over a year ago.
Oh, you
And
did? Okay.
yeah, and I had him on for not too long, but to be able to speak with you about that would be amazing because I know after I think one of the first or few sessions that you've done with this, we talked on the phone and you were just blown away. Um, and I always am when I hear Dr. Porges speak about health and the safe and sound protocol,
Right.
and obviously the vagus nerve. So it's pretty amazing stuff.
Right. I mean, what's been fun about this is that Dr. Porges actually did not know much about chronic pain, which I did not know. And then Dr. Clausen, and he did not know about cytokines. And Dr. Clausen brings an unusual genius into this program because he remembers about cytokines from medical school and college. We're going, what? He also gets into metabolism and cell biology that all of us have forgotten. Is an unusual genius of pulling that, not only remembering it, but applying it to this whole chronic disease state. So you take Dr. Clausen's knowledge of cytokines and metabolism, and then what he did not know is the polyvagal theory, and neither did I. So all of a sudden having DR taking his knowledge and putting it into the framework of the polyvagal theory has just been explosive. And everybody on the roundtable, I mean, I had an email from a doctor the other day. We're just having fun. I mean, we can't keep up with the learning curve. So it's really fun. So we're really trying to push things forward. We realize that there's lots of brilliant people in this world, but these silos of research aren't necessarily conversing with each other. And as we're getting people now introduced to each other, why we now have Dr. Aria working with the clinic in San Diego, doing chronic pain work and trying to mix that up. Dr. Arias introduced these, safe and sound, no, not the safe and sound, which is Dr. Porges' work, but these breathing techniques. For instance, it helps me personally. He goes, if I breathe through my nose, I just increase my oxytocin levels by 1,500%. That's not bad. Or when I do mindfulness meditation, it's not this psychological construct. I've directly stimulated the vagus nerve. Somehow that feels good to me.
Oh, absolutely. Absolutely. So for people, and I'll make sure to post the link because I know I'm probably getting a bunch of messages like, make sure you post that link. But for people that do suffer from chronic pain, what's the typical turnaround time that you've seen with your applications and the direct your own care way of doing things? let's say if someone's been in chronic pain for years and years and nothing's really worked, how long do these methodologies take in order for neuroplasticity to kick in?
It can happen within a day. Now, I say that very carefully because that's not the rule. I mean, I always say within 3 to 6 months, most people go to pain-free, but with a caveat, they engage in the tools. In other words, you're using tools to regulate your body's chemistry. Whenever you have enough skill to regulate your body's chemistry, the pain will go away.
Cool.
And everybody is different. And as Dr. Porges pointed out, that a lot of people aren't ready to give up their pain. Because when you're in pain, you're a victim and you're angry. Well, guess what? Anger protects you from being vulnerable. Remember, every living creature avoids vulnerability because it's a survival feeling. And as Dr. Porges points out, that if you're not ready to be vulnerable, you're not going to do it. It turns out that anger keeps you safe. Anger covers up the feeling of vulnerability. And so that's why we have the sequence on the Doc Project of simply learning the tools, understanding that there's hope, and then allowing your brain to change at its own pace. That's the key. If you work at it, in other words, if you work at solving the problem, your attention's on the problem, not the solution. So with neuroplasticity, you want to direct your brain to what you want your life to look like, pain or no pain. What do I want in my life? Who do I want in it? How do I want to get there? And as you pursue your life, regardless of the pain, then you leave the pain circuits behind. We also know from neuroplasticity, when they've done research where they blindfold people and do research MRI scans on their brain, that within a day, the auditory center starts taking over for the vision center. Mm-hmm. And the shifts happen very, very quickly. So with Tom Sullivan, the person at 27 surgeries, it's a remarkable story. What happened with him, he had a suicide attempt. And he was on high-dose narcotics, and for the first time in 20 years, he was off narcotics. We now know from the cytokine theory that narcotics are inflammatory. They inflame the brain. We also know the term called, is the term in your world called upregulation of narcotics, where you become sensitized?
Yeah.
So your brain becomes super sensitized. So it's not a tolerance issue. Well, there is a tolerance issue, but the sensitization issue is bigger. And what we find out, we're in high-dose narcotics for a long period of time, is your brain becomes sensitized. So with Tom, he was forced to come off the narcotics because of the suicide attempt. Then he started to think. He could think clearly again. Then he realized, then he read the stories of hope. On my website, there's a section on stories of hope. There's 30 or 40 stories of hope. Because every doctor had told him, there's nothing we can do. You're too complicated, right? And I wouldn't have said that to him myself personally, even though I would have thought that. But my whole thing is, I never know. So I would, if he was my patient, I would encourage him just to keep moving forward. But he represents a remarkable change within about 2 weeks after he crossed the anger divide. He realized that he was angry as hell. He hadn't recognized it. His physiatrist or rehab doctor at the time kept saying, Tom, why are you angry? What are you angry at? He goes, I'm not angry. And I always ask the question, when you're in chronic pain, how can you not be angry? Number one. Then it came out that his father beat him. He had suppressed that. Within 2 weeks after this, anger opened right up. Pain disappeared. After 20 years on narcotics, within 2 weeks after he crossed that anger threshold, the pain disappeared. Every person that I've seen that's truly healed, not that you can't improve, has crossed this anger divide. And I'd love to do another podcast with you just around anger and forgiveness, because that is the key issue. Because with neuroplasticity, how do you program a new brain if you're holding on to the past? And people become very critical of themselves for holding on to the past because they know better, but these are ingrained pathways. You can't just let go of the past. You have to use specific tools to actually break these links and then redirect. But yeah, so the answer is 3 to 6 months on the average, a lot of times within weeks, but it really depends when you cross that anger divide, and everybody is different.
Cool.
How's that for a very long answer for a simple question?
Oh, I think that was perfect.
Okay, good.
In the back of my head, I think like we're trained in society. I call it, with our patients, I call it the convenience of conventional medicine. Just to say like, hey, there's a quick fix for this, there's a quick fix for that. Amazon Prime, it'll be here in 2 seconds. Like our mind and our expectations are quick fix. So I think like a shift of mindset plays a role in all this as well. Would you agree or?
Well, a couple of things about that. First of all, medicine has marketed it that way, right? So we've offered the quick fixes that don't exist. We actually know that most treatments we do in spine surgery don't work. They've actually been documented to not work. So you get your hopes raised and dashed, that actually induces pain, actually induces depression. So, and then the process, the doc journey is not hard. And what happens, there's a different anger that comes up once people go to pain-free. This includes myself, by the way. I'm honestly still working on this. So I lost about 15 years of my life in a marriage because of chronic pain. I'm still not that happy about it. And when I realized that the process involves in dropping stress chemicals, writing, relaxation, not discussing your pain, sleep, right there, the pain drops down over half. Then about the anger and forgiveness, I mean, talking about not being connected to my anxiety, I had incredibly repressed anger from an extremely abusive childhood. I had no clue. My thing was just bring it on. Once I crossed the anger divide myself, within 6 weeks, I was fine. And I've been fine for 15 years. It's disturbingly simple how quickly this can occur. The vast majority of my patients never saw a psychologist. The psychology, again, I'm a supportive psychologist. So I don't want to be negative on psychology because psychologists that know the tools, we call it somatic psychology, they can help people calm down, again, provide, sorry about that dog, provide, if they can help provide that safety net and reassurance and move them forward, it's wonderful. In other words, people move forward faster with psychology support. But there's a tendency, what I thought is that if I just knew enough about the problem, that it would solve it. Well, again, by analyzing the problem like crazy, you're actually reinforcing those circuits. You don't learn French by trying to avoid speaking English. You don't solve chronic pain by trying to fix it. You solve chronic pain by learning a new language that I call an enjoyable life, right? So you got to get your eyes on the solution, not the problem. One of the basic rules, which has been incredibly powerful with chronic pain work, is never complain. Don't discuss your pain or medical care with anybody, ever, except for medical providers. That's it. So that's been, we sort of ran across that by accident in our workshops, but people in chronic pain, including myself historically, talk about their pain all the time. But also, since the mental pain is a bigger problem than the physical pain, guess what? Quit watching the news. Why watch the news right now? It just, again, it's a threat. It fires up your nervous system. People have the pain increased. We also know complaining. Where's your brain at if you're complaining, honestly? No giving advice that isn't asked for or criticism. In other words, be nice. And it's a little bit, that may be where it sounds sort of crazy, but we're used to gossiping, we're used to complaining, we're used to bitching. You can bond, you have sort of the funny bond based on anger and common misery, et cetera. It just reinforces it. In fact, one of the worst prognostic factors for chronic pain is belonging to a fibromyalgia support group. And the reason why they're complaining all the time. That being said, we think that the group setting is the most powerful way out of pain, but the cardinal rule of a group setting for chronic pain is to never discuss your pain or complain about it or discuss your care.
That's awesome.
Right? I mean, it's all about neuroplasticity and stimulation. But yeah, I mean, two issues that I think we've talked about this before, but I'd love to go over it again in light of the cytokine theory is, well, first of all, just a quick aside, this work group on Wednesdays has published a paper proposing a solution for the COVID pandemic. Did I send that to you yet, the Plan B?
Plan A and Plan B, right?
Yeah.
Yeah.
So Plan A is what you can do as a individual to lower your inflammatory markers to avoid that cytokine storm that kills you. So there's 10 different areas of dropping down inflammatory cytokines, which inadvertently turns out to be the dog project. Remember, every one of those tools lowers inflammatory cytokines. Again, with chronic pain, everything works a little bit, but nothing works in isolation. So it's that combination of approaches of dropping cytokines that solves chronic pain. Same thing with COVID. As you go to an anti-inflammatory diet, doing the expressive writing, exercise, relaxation, humming, singing, all this stuff lowers inflammation and it decreases your chance of dying from COVID. So that's Plan A. Plan B then recruits the autonomic nervous system who actually fight off the sympathetic storm. And we think there's an extraordinarily high chance to solve this pandemic like now. And I'm getting ready to write an article on why vaccines, this search for a vaccine is actually probably killing a lot of people because we're distracted. The vaccine is not going to work. I can discuss that for a second if you want, or
Sure.
so let me explain why the vaccine is not going to work. So first of all, I think there's a high chance we're going to get a vaccine. One of my friend's wives is a high-level virologist who worked in the AIDS epidemic. There's a spike protein that she feels like there actually is a high chance we'll get an effective vaccine. But here's the problem. First of all, 20%, first of all, it's not being tested very well. So if somebody gets sick for another reason, whether it's a flu or some other reason, they're going to blame the vaccine and sue the vaccine makers. There's a historic precedent for that with the silicone implants in Dow Corning. They actually proved that the silicone implants never caused autoimmune disorders, but Dow Corning still had to pay. So there's going to be a lot of lawsuits over the vaccine, even though it's not related to the vaccine itself. Second of all, the vaccine's not been tested very well, so there may be some significant fallout. And I'm not sure I would take the vaccine. If it's being poorly tested, all of a sudden you get a major reaction to it, that can be a big problem. Then there's a politics. First of all, then you have to produce it and distribute it. So who gets it first? Then the politics around it are just brutal. So we can't even get testing out, which is as simple as it gets. Putting a vaccine out is going to be 100 times more complicated. So what's happening is we're distracted by this pursuit of a vaccine. We have the actual therapeutic treatments that are effective right in front of us. So for instance, vitamin D is the most common vitamin deficiency in the world. You need that vitamin to actually kill the virus. This is actually like a drill into the virus. So 3/4 of the world has a vitamin D deficiency, especially nursing home patients and especially people in prison. Who's dying, right? Magnesium helps vitamin D function. Zinc is a metalloprotein, just like iron is in red blood cells. You have zinc in proteins that kill the virus. Elderly people have zinc deficiency. From my perspective, it appears to me that the people that are dying in nursing homes, people say, well, this person's 100 years old and they survived. Okay, well, I bet their zinc levels were fine. You take somebody who's relatively healthy without zinc, they're going to die. So we're not covering the basics, and there's a whole bunch of things to talk about in this Plan B, but Plan B creates a very logical stepwise approach using existing resources to solve the problem. We actually have the solution right here, right now. So my personal frustration, why I'm ranting here a little bit, is that we actually proposed it to multiple people around the country. I have not given up, but people aren't looking at it. Again, this vaccine's a big distraction, and we're actually taking our eye off the ball with the hope of this vaccine, and we should be just digging into the basics right now.
Yeah, I mean, keeping it simple, right? Like you said, looking at shifting sympathetic versus parasympathetic, shutting down that sympathetic storm, activating vagus nerve.
Right.
It's amazing how sometimes it's the simplest things that can help set our system up for success.
Right.
So it's exciting stuff. Well, yeah, I mean, thank you so much.
So that document came out of the Wednesday groups. Again, hop on and listen. Dr. Porges is just wonderful to listen to. He's, as you know, he's very inspirational. And then there's the same link. If you hop on my website, now it's still backincontrol.com. It's wonderful to listen. It'll say question and answer with David Hanscom. So that's Tuesdays and Thursdays at noon Pacific time, which has been wonderful. But that's the same link that we use for Wednesday night at 5 o'clock Pacific time. So just hop on, hit the link you're on.
Yes, I have lots of requests for the link, so I'll make sure to post that. Okay. Well, yeah, thank you so much, Dr. Hanscom, and I'll also share the Plan A and the Plan B documents that you sent me, if that's okay with you.
Yeah, no, that's why I'm here. I'm really trying to get this message out in the world. I mean, as you can tell, I quit my practice to do this. I mean, the difference between the successes and failures became so extreme. That's why I did this. And then again, this new pathway, the doc journey, is super excited about. And I think it ups the odds of actually getting better because it's a much clearer pathway through the sequence. And again, it's a set of concepts that gives you control. Once you can control and auto-regulate your body's chemistry, bring it on. So remember, stress isn't the problem, it's a chemical reaction to the stress. So you can't control most of your stresses. And people forget that the stress that's the most damaging is the stress that you can't control, right? So this idea of stress management is a huge misnomer, but you have a huge amount to say about the reaction to the stress. And that's the essence of the solution to the COVID problem. It's the essence of the solution to anxiety. It's also the essence of the solution to chronic pain. It's just calm down.
Love it. Yeah, I'm excited for the app, and that is the app can be the links to the app can be found on thedocjourney.com.
Right.
Like you mentioned, it is coming out in November, so when it does come out, we'll make sure to post the link, and maybe in November we'll meet again and talk a little bit about how the app's going.
Well, we would just be clear. So the Doc Journey has already started.
Yeah.
So the sequence of emails that goes to the app, we're actually put on the videos. We're actually in action with the Doc Journey. So we're looking at the app as the backbone. We already have the backbone going. So the Doc Journey is in action now. We're already rolling on it.
Oh, okay, that's right.
So, yeah, I mean, we wish the app, putting together an app is hard. I mean, there's lots of technical details.
Never done it.
I'm amazed. Oh my God.
Yeah, I can't imagine. And honestly, to take all the content that you've created and to put it in an app is, I'm sure, a challenge in itself.
Well, I don't know if I told you this, but you know Babs, my wife.
She's awesome.
And as you point out, the Gwen Stefani poster to the back here.
Yep.
Ryan, Babs and I are Gwen Stefani fans anyway. No, we really are. And so this is in Las Vegas, by the way. Anyway, Babs sort of kicked me off the project.
I love that the email he said, yeah, so Babs kicked me off the project. I was like, oh man, Babs.
So she got the content's there, of course, but we put the sequence on awareness, hope, forgiveness, and play, which is the Omega workshop. And Babs and my stepdaughter Jazz, there's a cup song, there's singing, there's rhythm, it's basically designed to create an experience of safety. It's very creative. And then again, the content is there. I just put it in. I had to put it in through videos. I still had to get my word in. But the main aspect, it moves right along. It's very compelling. It's also very entertaining, and we're excited about it. So I do give her a huge amount of credit.
Absolutely. Yeah, and we'll make sure to check it out and post. And yeah, Babs is awesome. So we love Babs. So, well, Dr. Hanscom, I can't thank you enough, and I will make sure to post all the links. And if anyone missed this, I'll make sure to post a link to the recording. Please check it out. Dr. Hanscom is seriously a wealth of knowledge, and just talking to you, Dr. Hanscom, makes my vagus nerve feel pretty good. I always feel calm and collected when I'm talking. Thanks so much.
But I just want to tell your audience, I mean, Ryan, again, I'm excited about your after the International Association of Functional Neurological Rehab. Did I get it?
Yes. Yeah. Please put your name a little bit.
Right. It's taken me a year to get that name with those words. But anyway, their group, I mean, I will sound negative here for a second. So in medicine right now, there's a certain arrogance that we know what we're doing, but the problem is we are ignoring the data. Your group specifically is all over it. It's really impressive about the neuroscience with it. I know some of the stories of your successes. And so I just want to echo my excitement for what you're doing with the website, with Janice, and just creating this whole world in your chiropractic world. I think it's just phenomenal. So I'm really excited about that too.
Thank you so much. Yes. And yeah, we'll have our annual conference. It's going to be virtual this year, as is everything, but that'll be in October. So we're excited to get that rocking and rolling. And we definitely need to have you back because your class is awesome. It was interactive and fun. I still have videos on my phone from that class.
Oh, you do?
Oh yeah.
Oh, cool. Yeah, it was a lot of fun. We had a great time.
Yeah. Well, seriously, Doc, thank you so much. And I'll be emailing you to get you back on in the very not so distant future.
All right. Thank you.
Thanks everybody for watching. I'll make sure to post. Bye, everyone.